everyone, and welcome back to the next episode of TILLY. I'm your host, Marissa Zeppieri-Caruana. A lot of you already know me as Lupus Chick. TILLY is brought to you by the Lupus Foundation of New England. And tonight, our episode is sponsored by Aurinia, and we're going to be talking about lupus nephritis. This discussion is called Lupus in a Lupus Nephritis Panel. We will be hearing authentic personal experiences from someone that is living with lupus nephritis, and also from two medical experts who will help inform, activate, empower, and support other people and care partners in their journeys with lupus nephritis. We will learn more about lupus nephritis, including the journey to the diagnosis, treatment, and management options, day-to-day life, and working with the healthcare team and your support systems. So I would like to introduce Dr. Levin and Dr. Clayton. Dr. Levin, if you could please tell us a little bit about yourself, that would be great.
Sure. My name is Michael Levin. I'm a clinical nephrologist in the Philadelphia area. And one of my passions is seeing patients succeed with these diagnoses that over the years have been more challenging, and just having them have all around success, support, and great outcomes.
Thank you so much. We're so glad to have you on tonight. Dr. Clayton, we'd love to hear from you as well.
Hi, I'm Elizabeth Clayton. I'm a private practice rheumatologist on the Eastern Shore of Maryland. And like Dr. Levin, I really enjoy treating patients who are more complicated and have multi-system diseases like lupus. And it's an exciting time because up until recently, there haven't been great treatments. So it's a very exciting time for all of us who treat lupus patients, especially lupus nephritis.
We're so excited to have both of you here with us. And we're also going to introduce Jennifer, who is a lupus nephritis warrior. You're going to be hearing a lot about her experience tonight, but I want to jump right into actual lupus nephritis. So I want to begin with an overview of lupus nephritis. Dr. Levin, if you can tell us a little bit more about it, what it is, and who's affected.
Sure. Lupus nephritis is a common and unfortunately a serious complication of lupus that affects the immune system, and the immune system begins to attack the kidneys. It can affect up to 50% of people who have lupus, and 1 in 3 of adults in their lifetime with lupus nephritis may have progression of the disease. In lupus nephritis, the kidneys don't function properly to remove things like waste and toxins from your blood, control the amount of fluids that your body has, and there are a lot of side effects that we'll talk about that lupus patients can deal with. It's inflammation in the kidney that can cause permanent damage. And it's a serious health problem that if we leave untreated, undiagnosed, and don't really acknowledge its significance, it can lead to kidney disease and kidney failure. And in those situations, things like even dialysis and transplant become more prevalent.
So it's more common in women, although men can be affected, and when they are, it's typically more severe, a type of lupus nephritis. There's a higher prevalence of lupus nephritis in certain racial and ethnic groups. So African and Asian patients have a higher risk for lupus nephritis. Hispanics and Latinos and Native American populations are also more likely than non-Hispanic white patients to have lupus nephritis. Patients of African and Hispanic descent with lupus typically develop their disease earlier and have a more severe course than the non-Hispanic white populations that develop nephritis.
Thank you both so much. There's so much to know about lupus nephritis. Jennifer, I want to ask you, what did you actually know about lupus nephritis before you were diagnosed?
So I knew nothing about it. And actually, I didn't know there was a difference between lupus and lupus nephritis.
So jumping in from really not knowing a lot about it to actually getting diagnosed, if you can share with our viewers your story, how you were first diagnosed, and maybe what symptoms you experienced, or how did you know something was wrong at first?
So I was traveling actually when my lupus symptoms first appeared. And what happened was my legs started to swell up. And then I sort of thought it was from mosquito bites because I usually have a reaction to that. But then the swelling spread to the upper part of my body. So when I got home from my trip, I went straight to the ER and I found out I had gained more than 20 pounds within a few weeks. At the hospital, I had blood tests, an ultrasound, and multiple other tests done, including a kidney biopsy. And then after I'd been home for a few days, the doctor called me to tell me I had lupus nephritis.
Wow. So Dr. Clayton, Dr. Levin, we heard a little bit about Jennifer's symptoms, but how do you typically see patients present with lupus nephritis? And then how is it typically diagnosed?
Sure. So the hallmark of the disease is actually proteinuria, which is leakage of protein into the urine. This can present as multiple things. So foamy or frothy urine is something that we commonly see. Because there's so much protein in the urine, you actually have more frequent urination. And you can also see blood in the urine as well. Though a lot of patients, we see what we call microscopic hematuria, which is where the blood is there on testing, but you actually can't see it. Blood pressure can go up as a result of this because your kidneys help to regulate blood pressure. And this is all caused by inflammation and scarring in the kidneys themselves.
When we have these type of situations, it's very, very common that rheumatologists and nephrologists are working hand in hand, really co-managing the case in a very personalized manner. When patients come to see us in the office, we're looking at a few different things. Urine becomes really beyond crucial, and we're looking as described by Dr. Clayton for the blood and protein, and that gives us an idea of how well the kidneys are working. The more protein, the more inflammation, the more concerned we are. Certain blood tests are often done, and one of them is a chemistry panel that includes a value called a creatinine. And that's a product that the kidneys help filter out. And that helps with equations to us determine how well the kidneys are working, how well they're filtering the blood, and to what degree there is damage and hopefully reversibility. Finally, and most importantly, is a kidney biopsy, where under a very, very gentle procedure, a biopsy is done, and we look at this kidney under a microscope with 3 different ways, and we see how the kidneys have been affected. And we do our best to classify this stage of lupus nephritis and how best to figure out what's the proper treatment and really fine tune the treatment to the individual. And I can't stress enough how co-management in these conditions leads to great outcomes.
Thank you. There is so much to learn about the symptoms, and it's interesting to know how it's actually diagnosed. Jennifer, once you were diagnosed, as we know, lupus can affect so many things in your life. How did things change in your life?
That whole period after my lupus nephritis diagnosis was really a bit of a blur. I heard the news, but I don't think I really understood what it meant. I mean, I was in my 40s, healthy, in good shape, working at a job I loved, in a good relationship, and then this happens. You'd think that I would have gone instantly online and started researching everything I could about the condition, but I'll be honest, I didn't do that. I just relied on my doctors for information. And my doctors were really good at being positive. So while I know that they told me this was an ongoing disease and that it could potentially lead to outcomes like dialysis and kidney transplant, I thought those things might happen to other people, but not me. I guess you could say that I was in denial, and that's how I reacted. And I went on a few medications, including an immunosuppressant and steroids, and my condition improved. And after a few years, my lupus nephritis went into remission. And so I thought that was the end of it. But of course, it wasn't.
So, well, speaking of treatment options, Dr. Levin, can you tell us about a treatment option specifically for lupus nephritis that you prescribe for your patients like Jennifer?
Sure. I think Jennifer did a great job describing what she's been through, and these concepts of honesty and transparency are crucial for all of us. Lupus or voclosporin is a prescription medication that is used with other medicines to treat adults with active lupus nephritis. And it's something that I prescribe to the patient population that we treat, like Jennifer. It should not be taken with a medicine called cyclophosphamide, and it's important to always talk to your healthcare provider if you're not sure if you're taking this medicine, and always let your healthcare provider know what medicines you are taking, because we always want to be aware of what's going on in the background. It's important to know, like other medicines, lupus can cause some serious side effects and increasing the risk of cancer, as other immune modulating drugs can do as well, and also infectious. The most common side effects that we see, while rare in lupus, are diarrhea, headache, cough, some urinary tract infections, stomach pain, heartburn, and sometimes even loss of hair, alopecia. It's always important that when a practitioner prescribes a medication like lupus or voclosporin, that we share these additional safety informations with you, so there can always be active and honest discussions about, is this the right medicine for you? I always make reference to www.lupus.com, so all the safety information can be seen and all these questions can be answered fully.
Thank you, Dr. Levin. Now, Jennifer, you are actively taking lupus. Can you tell us how you learned about this option?
Yeah, I was on a previous treatment plan that really wasn't working for me. And then the pandemic hit, and I started to develop this unhealthy obsession with what my life was going to be like if I didn't get better, and if the pandemic lasted for years. And just as I started to go down the dark hole, my doctor suggested that we try a new drug, LUPKINDness, to treat my lupus nephritis. It had just come on the market a few weeks prior, so we talked through some of the details about the drug, as well as the potential side effects before deciding to move forward.
Thanks for sharing just your conversations that you've had with your physicians. I want to ask Dr. Levin and Dr. Clayton, how do you bring up this conversation with your patients? And what does that first discussion about treatment typically look like with your patients?
Sure. I'm happy to go first. By the time that we as nephrologists are involved, so often this is, as we described earlier, being managed as well by rheumatology. And I think one of the important things to realize is medicines like LUPKINDness as an oral agent, voclosporin, is not a salvage medicine. It's a great medicine that targets the kidney specifically, allows for great success. And in the past, like other medications, we're not following levels of things, which gives us a sense of comfort. Like anything else, patients may come to us without having being treated earlier, or have not had the best response to other treatments. So I think the most important thing is really understanding the therapy, understanding the significance, going over the diagnosis, and making sure that the patient understands that there's great hope. These are complicated things, and I know Dr. Clayton has great opinions on this as well, and I'll turn it over to her. But the most important thing that I think we both believe strongly in is individualizing the care for the individual, not just following individual protocols. Dr. Clayton?
Absolutely. So I think a big part of this too is the education piece, and Jennifer kind of alluded to this too. A lot of times it's very overwhelming for patients when we make these diagnoses. So I try to be there, me and nephrology, because I do a lot of co-management, as Dr. Levin alluded to. We try to be their like lighthouse in the storm, so that we can be the people that they're getting information from, just to make sure what they're getting is actually kind of accurate and appropriate, I would say. So I like to do a lot of education with these patients after diagnosis over the first few visits, and talk about what the options are. I think, as I said in my introduction, I think this is an incredible time for patients diagnosed with lupus nephritis. We have treatments that aren't a salvage therapy, as Dr. Levin said, right? That are not just trying to, stop the disease process, but they're trying to actually reverse the process, if you will, and fix the kidney so that in 10 and 15 years down the line, when their disease is well controlled, their kidney function is still good and appropriate. So, I think talking about the big picture here and the long term, right? What we're doing now is going to affect the kidneys in 10, 15, 20 years. I think those are the way I kind of frame the discussion when I speak with patients about this.
Interesting. Thank you for sharing that. I like the idea of looking at things long term and actually helping the kidneys over time. Jennifer, I want to jump over to you. So what has changed for you since starting LUPKINDness?
So, how I take the pills and everything, it's kind of changed my routine, actually. Right now, I take 3 tablets twice a day, and I try to take them on an empty stomach once before breakfast and once before dinner. In the beginning, it was harder to remember to take the pills at the right time, but I've gotten better at remembering. I started incorporating them into my daily routines. For example, I take them first thing in the morning before I feed my dog and make breakfast, and then again in the evening when I start thinking about dinner. And after I started taking LUPKINDness, my first set of test results, including blood work and urinalysis, showed improvement.
Oh, that's wonderful. So I want to kind of switch gears a little bit really quick. Can you tell us about your experience, Jennifer, with the Aurinia Alliance program that actually supports people starting their journey with LUPKINDness?
Yeah, so when I wasn't sure about my insurance and LUPKINDness, this is when my Aurinia Alliance nurse case manager came in to save the day. I didn't realize it at the time, but taking this new drug meant that I would be assigned a dedicated nurse case manager. And she gave me information about LUPKINDness, answered my questions, and most importantly, she coordinated with my insurance and my doctors to help me get coverage for LUPKINDness. And even now, I still get occasional check-in calls. And while I haven't had any questions lately, it's just nice to know that if I need something with regard to LUPKINDness or lupus nephritis, I have someone I can call. And I'm really, really grateful for the support because I know, given my emotional state at the time, dealing with insurance and getting questions answered would have been really difficult without the extra help. And for the refill process, the specialty pharmacy just calls me and actually sends my pills to me directly to my house.
Oh, that's great. So Jennifer, I want to ask because a lot of our viewers here like to hear like day-to-day tips or just insights from other lupus warriors. So what other ways do you manage your lupus nephritis day to day?
Honestly, I'm trying, trying to be more gentle on my body than I used to be. So if I'm tired, I try to take it easy and not overschedule or push myself to work out like I used to. I am still trying to exercise regularly without overdoing it, but it's been a little hit and miss lately. So I'm also a bit more aware of what I'm eating, and I try not to eat too much of anything that I know might upset my system. And that includes not really drinking as much alcohol as I had in the past. This is my experience, and other people may have different experiences.
I appreciate you sharing just a little bit about your day to day. I want to ask both of the doctors, what advice do you give to your patients to help them manage their lupus nephritis day to day?
Sure, so I can take this one to start. So I say the same thing that Jennifer said. This is a multi-system disease in the majority of patients. So I think being kind to yourself and giving yourself the grace when you are fatigued and you don't feel well, it's great to push ourselves. We all want to do that. But I think kind of understanding how significant the diagnosis is and how severe things can be, I think is a really important perspective. I also am a big advocate for making patients their own advocates, right? So I really encourage patients to be logging into our portal and to whatever lab company they use, that portal to be looking at their labs, watching their progress, tracking things, being very engaged with their health team, with their nephrologist and rheumatologist and primary care. Just because it's very gratifying when you put the work into, as Jennifer said, about adjusting your schedule and taking your